Welcome to the Accidental Experts podcast. I'm your host, Bryce Hamilton. I'm a licensed clinical social worker and a child and family therapist. I have been in practice for over 15 years, and I'm also a mom of 4. So I know the challenges both professionally and personally. I'm so glad that you're here today to grow your parenting toolbox. Please come as you are and be ready to learn. My goal is to make you the accidental expert so that you can raise healthy humans. Hi, everyone. Welcome back. I'm so glad you're with us today. So we are going to be talking to a concussion specialist. She is a physician who spends all of her time now managing and helping families and kids and teens, as well as adults, navigate the impacts of concussion in their lives and treating them. So Dr. Lori Boyajian-O'Neill is going to be with us today, and she is going to help us to understand what concussions are and how to help support our kids. With that, let's get to Dr. Lori.
It's great to be here with you, Bryce.
Yeah, this topic of concussions is such an important one. I think as parents, there's so many things that we don't get trained in, but concussions was never something I was trained in before becoming a parent. So what do we need to know about concussions? What are they?
Well, let me say, you're not alone. If we go back 20, 30 years ago or beyond that, there were no concussions. When I was growing up, there were no concussions. You got your bell rung, you got dinged, and you got right back up, and you got right back on your bike, you got right back in the game. There were no concussions. As a colleague of mine has said repeatedly, for centuries, concussions have been looking at us in the medical field. We haven't been looking at concussions. But over the last 20 years, that has changed. And if we go back 15 or 20 years ago, I spent a lot of time educating folks on this is a concussion. These are the signs and symptoms. This is the way you treat concussion and all of that. I have to do that less and less now that the word is out. Now that you turn on the television and ESPN talks about this athlete or that athlete with concussion. So it's front and center. You open up the Kansas City Star digitally or old school, and you read about concussion. So we're surrounded by that now. So the awareness is much greater than it was 15 or 20 years ago. So you are not alone. And the fact that most of us grew up not being aware of concussion kind of can present a bias. It's not really that serious, or you're fine. Everybody gets a headache. It's no big deal, that type of thing.
Yeah.
So you are not alone.
Yeah. Yeah. It's good to hear that. I mean, I think you're right. I feel like it became, as an athlete or previous athlete myself, it became something that was being talked about, but still, I think it's people say concussion. I don't know that we always know what it is. So what is a concussion actually? What does that really mean?
A concussion is a traumatic brain injury. A concussion occurs when there is a force that either goes through the body and the neck and then through the head, or a direct blow to the head that causes a disruption in the function of the neural pathways of the brain. And so there are immediate changes in the brain that occur at impact: decreased blood supply to the brain, decreased ability of the brain cells to take up oxygen, to move sodium, potassium, glucose in and out of cells normally. These processes take place relatively quickly after the impact. Symptoms may not occur immediately, or not all of the symptoms may occur immediately, but these processes in the brain occur. And then over time, the concussion can show itself more and more.
Got it. Go ahead.
Headaches. Headaches are the most common symptom with a concussion. Over 85 or 90% of folks have a headache. You mentioned one of the myths of concussion is if you don't have a headache, it can't be a concussion. And probably about 10 or 15% of folks or so do not have a headache, but they have other signs of concussion that may get overlooked. Over 70% of folks have difficulty with dizziness. And there are many other symptoms, but headache and dizziness, vision changes are very, very common with a concussion.
So is there a time where we could have what you said, like a blow to the head or something through the body that goes through the neck to the head, and we don't get a concussion? Is that also possible?
Absolutely. We've all done that, right? We've bumped our heads, or we've been struck either just normal day-to-day life. Somebody opens a door into our head, or we're playing sport and we get struck in the head. And even if we observe this, it might look like it's pretty significant, but the person is fine, or we feel fine, like, well, okay, I kind of got lucky there, and we move on. And so a lot of the mechanism of why one blow to the head that may look significant causes no symptoms, and another that's rather insignificant causes symptoms, we're just not sure of those mechanisms. But the reality is that I have patients who are cleaning underneath their tables, come up, we've all done this, whacked our heads on the bottom of the table, and then really significantly symptomatic. We see this we're in the starting football season right now. We might see somebody who really has a horrific blow to the head or to the body, and they might be tended to by athletic trainers and medical personnel from the sideline, but then they get up and they seem to be fine, and it might be a different type of injury, but the blow was remarkable when you're witnessing it. And there are no signs or symptoms of concussion. And then somebody else, you say, well, geez, we'll see it on replays on TV. It just doesn't look that bad, but we're not living inside that person's body and that person's brain, and the significance of the symptoms can be rather profound.
Yeah. Well, and I think that just speaks to the complexity of the brain. I know in the psychology field, right, which is where I'm the expert. I mean, I think we are still learning so many things. There's so much to be learned, right? There's so many things that we just don't understand yet about the brain. And this speaks to that too, of like, there's so much still to be learned around this
That's
area.
absolutely right. So when we're taking inventory of symptoms, when somebody comes to our clinic, not just only for the first time, but when they come to our clinic for subsequent visits, we take an inventory of their symptoms and their rating of the symptoms of the symptoms. Oh, so this used to bother me, but it's not so bad anymore. It's getting better. Or this is persistently bothersome to me. And headache is one of the symptoms that we inventory, but headache, dizziness, lightheadedness, sound sensitivity, light sensitivity, mood changes, irritability, emotionality, sadness, being nervous or on edge. We ask those questions at every single visit. In fact, in our clinic, we also do a separate inventory, a questionnaire for anxiety, and one also for depression. We see less true depression. We see a lot of sadness. People are sad when they can't play their games or be with their friends. We feel sad when we can't go play pickleball if we were 70 years old, because that's your social outlet and your recreational outlet. So sadness is one thing, as you know, but depression is another. We see a lot of anxiety, true anxiety. So anything we bring with us into the brain injury can be, doesn't have to be, but can be amplified with the brain injury. So if somebody has a history of anxiety or depression, this may be amplified with the brain injury.
Yeah, that makes a lot of sense. It made me think when you were saying that. So something that I talk a lot about is trauma in my practice, and a brain injury where you're having that concussion is a brain trauma as you defined it. But I wonder if it's also like a trauma in the like more emotional world too, of like trauma just is defined as in psychology as like something that happens outside of what you can cope with at the moment. And so being somebody who's in that position and you rob them because of the concussion of the things that they use to cope, it makes a lot of sense why that would emotionally elevate the intensity of that event. Of like, we have the brain part and our brain is trying to heal, but then we also have the emotional element. So it's like a double whammy almost.
It's absolutely right. I tell my patients, we're not robots. We are human beings, and we respond emotionally. And depending on the effect of the concussion on our lives, then we may have a greater emotional response. For example, if the symptoms are so significant that you cannot attend school in the manner that you did, maybe you're only going half days, can't play on your football team or your soccer team, your softball team. These are significant life changes. And also how you see yourself. You see yourself as a mental health professional. You're in the all of the psychologic aspects of of what your own patients are going through, you help them with. So you see yourself in that role, as I see myself in the role of physician. If that was taken away from me, this would be a big transition for how I see myself. And so when you are a young person and your identity is, I am an elite soccer player, and you can no longer do that, and you lose that part of your identity, even if it might be a month or so. I'll counsel patients, look, we're not talking about you can't play soccer forever. We're just saying we're just going to back away for a few weeks or maybe even a few months or longer in the worst case scenarios. But the fact that that in this moment they can't participate in the manner that they did prior to the brain injury really can cause significant emotional problems. And then if you're an adult and you see yourself as the caregiver, the protector of your family, the one who earns income for basic needs and for extra needs, and you can no longer work like you used to work. You no longer can generate that income, even if it's just for a short period of time. That can have significant financial ramifications. And how you see yourself. I'm the protector of my family, and I no longer can do this. These are significant. They're not inconsequential, as you well know, but I think they're dismissed often by insurers and other entities who seek to diminish that aspect of this brain injury.
Yeah. So how do you get a concussion? Obviously, there can be lots of ways, but you've described what the mechanical part is, but how do you see people presenting in your clinic with concussions?
So just from in broad strokes, athletics for sure. Millions of kids worldwide get concussion from athletics. Different sports have a higher risk than others. Soccer has a higher risk than softball, for example. Football, American football, not international football as they call it. American football has higher risk than, for example, basketball. So different sports have different risk attached to it. Different positions in those sports have different risks attached to those positions. Falls, especially in older folks, slip and fall, whether that be at home or out and about. Automobile accidents, assaults, whether that's domestic, whether that's an assault that occurs in public. Those situations, particularly automobile collisions and assaults, can really carry with it a lot of anxiety and post-traumatic stress.
Absolutely. So you talked a little bit about what the symptoms look like, but what should we be looking for as parents for our kids, but also ourselves if something is happening? What are the symptoms that you're most commonly seeing?
So headache is the most common symptom, but I think as parents, we need to ask, I saw this happen. Do you have a headache? Are you dizzy? Are you off balance? How do you feel? How do you feel right now? Do you feel normal? And if you do not feel normal, tell me why you don't feel normal. I'll have athletes say, well, this happened on the field, and then the coach and whomever came out and they helped me up and they helped me to the sidelines. And in sports, a lot of that's normalized. And I'll have to ask them, do people always have to help you up? Or do you always have balance problems? And when you say it in those terms, like this is not normal, that is a sign of concussion when you have balance problems. Then it puts it in a different perspective. So if you see your child behaving in that way, that's not normal, maybe holding their head, maybe off balance, then those are signs to a parent. But I think anytime that there is an impact and there's headache, that athlete needs to be removed from play and evaluated by a healthcare professional. That might be an athletic trainer on the sideline. That may be the pediatrician or the family medicine physician. That may be at the time of the incident and ER if their symptoms are worse. But headache, dizziness, lightheadedness, light bothering them, sound bothering them, crying on the sideline, more emotional. Teammates may notice that they're like, if you're in a huddle or you're on the sidelines visiting, that they just don't seem to be with it. They don't seem to be engaged. They seem to be a little confused. difficulty with memory, and that could occur at the time of the incident. So a classic example of this is if somebody who has a concussion in football that may not have gone, that was not obvious to the sideline or to the parents in the stands, and the player gets up and they seem from a distance to be behaving normally, etc. Their teammates might notice in the huddle that they're a little confused, that they don't
Mhm.
seem to understand the play, or they're not where they were supposed to be on a
Mhm.
particular formation or maneuver, whether that's football or soccer or whatever. And you have to rely on your teammates also to say to a coach, look, they're not right. There's something
Mhm.
wrong with them. That is a red flag. There are no big games when you're a kid, zero. There are games that parents play up as big games. The most important thing is the health and well-being of the child. And so teammates need to be empowered to say something to a coach. The coach needs to have perspective, and the parents need to have perspective too. And you see this more and more in recent years that as the word has gone out about concussion, the signs and symptoms, and the long-term, the potential long-term effects of concussion, that parents are more aware. And
Mhm.
I have parents, by and large, who come into my clinic who say they're not right. My child is not right,
Mhm.
whether they're slower in their thinking, whether they're complaining of headache or changes in personality, mood, that type of thing. Um, and so those are symptoms to watch for. I will say in the immediate, if there is severe headache or the headache is worsening, if there is severe nausea and it's worsening and there's vomiting, um, there is a lot of confusion, that would be a marker at that time to go to an emergency department and have an emergency department physician or other personnel evaluate that person, that whether that's an athlete or whether that's somebody else who maybe mom fell down the stairs and seemed fine at first, but now is having a lot of problems.
Mhm.
When there are significant symptoms like that, that merits going to the emergency department for sure.
Yeah. Thank you so much for saying about the teammates speaking up, because I think often, like, I know my kids, some of them are in sports, and this is something that I haven't even had a conversation with them about, is like, but I in lots of elements we're saying, if you see something, say something, right? If you're wrong, nothing bad happens, right? Whether
Right.
that's about child abuse, whether that's about, a friend doing something or being in a relationship that seems unhealthy, all of those places, it's like, say something to a grown up about that. But I love this in sports to be like, hey, Bryce is just not acting herself, right? Like something's off about her.
Yep.
And, I know she just had that play and whatever, but it just doesn't seem right,
Mhm.
and maybe that's something else totally unrelated to sports, but also, I mean, that's an important thing to look at. But like when we have something that happens and maybe the athletic trainer or the coach has cleared them, but they're just not quite themselves, saying something could really impact their life greatly in a very positive way, because then they can get the support that they need. So I love that. Thank you for bringing that part up.
Of course, it's just an important piece. We need to look out for each other.
Yeah.
And and when you have in sports, there are times where it's not so obvious. We
Mhm.
say, what happened to them? I was watching the ball over here, but what happened to this over here? And it may not be so obvious to anybody on the sidelines or the stands, but that's where teammates come in.
Yeah, because they see them every, whatever the practice schedule is, and they kind of get to know you, how you present in that sport. If you're a kid always picking daisies in the soccer field, then, you suddenly doing that would not be out of character. But if you're
Mhm.
somebody who is very in the game, then all of a sudden you're like distracted, wandering. It might be like something where it's like, oh, that's not quite right. But they know, right? Like the
I
teammates
know.
do know. I do
Right.
agree with that. So that's a great perspective. So why are concussions such a big deal? Are there long-term side effects? Like why do we really care? Like if our brain's just going to get better, like I
Mhm.
mean, in theory, right? Like
Right.
that's kind of the perspective of like, just brush it off, you're good. Like, why does this all matter?
So in the immediate, during, let's say, athletics, during the play, especially with adolescents, the immature brain, when there are signs and symptoms of concussion and those signs and symptoms are ignored and the athlete continues to play, they are at increased risk for a catastrophic brain injury. So you have signs and symptoms of concussion, you go back in, you get another impact, again, blow to the body, blow to the head. And that, by the way, can be from another player, could be equipment, could be that you hit your head on the playing field and you have one injury and now you've added another impact and the brain can swell catastrophically.
Mm-hmm.
And that's called second impact syndrome. It is very rare, but it occurs. And so that would be the ramification immediately and catastrophically for ignoring signs and symptoms of a concussion at the time of play, or in future in the days to come, where somebody has signs or symptoms of concussion, but they continue to practice, and then blow after blow.
And so can I pause you for a second? Why does it matter if our brain swells? I mean, I feel like I know the answer to this, but just to answer that question for parents.
So I explain to my patients, the brain is surrounded by a hard skull and fluid around the brain. And these are protective mechanisms. Nature provides this. But when an impact overrides these protective mechanisms, the brain can swell, the brain can be injured, the brain has no place to go. So when the brain is shifting violently inside this hard skull, the brain compresses and recoils. So you can think about this as like if you tap the side of jelly or jello or custard, where it moves and shifts back. So these are widespread brain injuries. And we know this from advanced imaging, functional MRIs, SPECT scans, things like that. We can see the areas of the brain that are injured. A regular MRI typically will not show any abnormalities whatsoever. And so the brain has no place to go. When the brain swells, it will then tend to go down into where the spinal cord area, and there's a very small opening where the brain then morphs into the spinal cord. And when the brain starts to get so swollen, it moves down, it herniates into this small area. There can be death. And this happens in trauma centers around the world on a regular basis, that there's a brain injury that's significant. Maybe there's brain bleed, maybe there's brain swelling, and the herniation occurs. And where this herniation occurs, that part of the brain controls respiration and heart rate, those vital mechanisms. And so that could lead to death. And so obviously, to say the obvious, we want to avoid that. So we want to avoid in our young athletes second impact syndrome. And we do this first and foremost by recognizing concussion and removing that athlete from play. Let a healthcare professional either make the diagnosis or not. And then if there is a diagnosis made, then develop a treatment plan. So that's the immediate consequence. Long term, one of the other myths of concussion is that everybody makes a full recovery, and 10 to 15% of folks do not, relative to maybe persistent headaches, cognitive changes. I can go to work every day, but I'm just not sharp like I was. I've worked this job for 10 years. I know it inside and out, but I'm slow now. I have to take notes now. I'm not the same. At home, I have to have somebody help me with billing, or I have to help people with a task list. At school, longer time to complete assignments. It's very deceptive, by the way. If kids can maintain their grades, there is a tendency to think that they're fine. Well, they were an A student before, they're an A student now, or BC or whatever, but they're struggling more to maintain those grades. Homework's taking longer. They're more easily distracted. There are higher rates, 2 times higher rates of ADHD-like symptoms after one concussion. Long term, you're at increased risk. You're also at increased risk for mood changes and anxiety after one concussion, and particularly after multiple concussions. And so the long-term effect can be significant. That is one of the myths of concussion I talk to all of my patients about. Not everybody makes a full recovery. So this notion that we started back, 20 years and 25 years and beyond, where we say, what's a concussion? There's no such thing as concussion. You just got your bell rung. Now we understand not only is it just symptoms for a few weeks, it can be permanent changes in vision, permanent changes in thinking and mood and sleep, and maybe persistent headaches. So that is part of the long-term sequelae of concussion. And I'm not even speaking of what we read about in newspapers and other digital media for chronic traumatic encephalopathy, which usually is related to news reports we get about retired football players, which is a altogether different type of sequelae. But it's a long-term sequelae, and it is hallmarked by dementia and changes in mood. And certainly that has come to the fore in recent years as we've learned more and more about that sequelae of repeated blows to the head.
Yeah. So what are parents, I mean, as we're talking about this, it's like I'm thinking about sports and concussions, right? Like I know that that's obviously you listed other times that that can happen, but as a parent of kids that are participating in sports, what do we need to know about sports and concussions to help protect our kids?
So I think first and foremost, with every sport, there is equipment that is designed to protect, um, whether that's our arms or our legs, or whether that's our head, helmets. So helmets, number one, can protect against a catastrophic brain injury. I'll use football helmets as an example. Football helmets are not designed to prevent concussion, and there are no helmets that will prevent concussion. Zero. Football helmets are designed to prevent skull fracture. And if you have a skull fracture and the fracture is such that it injures blood vessels around the brain, you can have a catastrophic bleed inside your head, and that can lead to long-term disability, horrific disability, or death. But number one, wear the right equipment and make sure it fits. Whether you're riding your bike, I have my Brain Injury Association cup right here. Whether you're riding your bike and wear a helmet, whether you're in football, whether you're in other sports that have helmets, make sure that it's the proper equipment and it's fitted properly. It's not moving all over the place. So that's step one, is understand your equipment, understand the rules. So as we all know, football particularly has modified rules to decrease these horrific impacts, these horrific collisions, and that has directly affected, in a good way, the rates of concussion in football at all levels. There are also rules that limit whacking somebody on the head with a field hockey stick or a lacrosse stick, that type of thing. A lacrosse um, is a sport that there's higher risk, especially in boys and men lacrosse. So understanding the rules is important as well. Okay, so understanding rules, understanding equipment, um, and and understanding. Um, I think that there has to be a marriage of understanding just the benefits of sports and teamwork and just personal growth that can occur through sports, and marrying that with your sense of what you are comfortable with regarding risk. I mean, it in part gets to that. And you know, some folks have their children in pee wee football, and then some folks will have on the other end of the spectrum, you know, disallow football, for example. And what we've seen in football is this emergence of flag football,
Mhm.
and this general accepted among most healthcare professional societies, this acceptance that perhaps we should not have contact collision football, tackle football, uh, when you're younger than age 14, which is to say basically a freshman in high school. And that flag football can fill in that gap for the desire to play football.
Mhm.
But I think sitting down with your child and explaining to them um, that you want to know as a parent if they don't feel right. You want to know if their elbow doesn't feel right or their knee doesn't feel right. You want them to feel comfortable coming to you saying, you know, I have a headache, or I I'm just not myself. A lot of this can occur in practice. Parents aren't even around, and you pick up the child from practice and they're just not themselves. Maybe they're quieter, maybe they're complaining of a headache, maybe they're just a little dizzy, maybe they just don't seem themselves, inquire, did something happen at practice?
Mhm.
How do you feel? That type of thing.
Yeah, that's great. So I hear what you're saying is it's not that we don't do sports, because I think,
Right.
like you said, I mean, some families choose that and that's obviously their choice, but it's not that your professional recommendation is don't do sports. It's just be conscious of the risks associated with it, talking to your kids about it, seeing what their comfort level is with doing things, and maybe also doing protective factors like equipment, making sure that those things are done properly. And maybe it's like if your kid does play contact football, making sure that you understand that the helmet is fitted correctly. Like, what does that look like?
Right. That's absolutely right. And understand what the limitations are to the helmet,
Yeah.
right?
And I think really, it's interesting that you said it is not in an effort to keep you from having a concussion. I don't know that I've ever thought, like, I know the purpose is to protect the head, but I guess maybe I naively thought that it was also to prevent concussion, but really that's not the case.
That's right. We don't have a product. We don't have a piece of equipment that can replicate kind of the skull and the fluid around the skull.
Mhm.
Um, we may get to where there's improvement, and there's some helmets that are, better than others for sure at absorbing force,
Mhm.
at maybe decreasing some rates of concussion, but there's no helmet out there that will prevent concussion. And I think that sometimes parents get led astray in thinking that that's the case. And that's the case with a bike helmet, with other helmets in sports, including football.
Yeah. And like skiing, I know that in like snow skiing, you see a lot of people, like when I started skiing as a young person, nobody wore a helmet, right?
Yeah, right,
And
right, right. Got the
and
wind in
now,
your hair.
yes, yeah, and now, it is a theme, I think, on the slopes to see people commonly wearing helmets, which, again, is helping to protect those catastrophic things, but not concussion. So it's good to just have that in our mind too.
That's absolutely right. The speeds in the collisions in skiing can be horrific. And at any ski slope in Colorado, for example, there are folks with wide ranges of skills.
Hmm.
Some don't need to be on that mountain at all. Some need not to be, the downhill skiing at the Olympics. They need to be on a different mountain with their other, highly skilled buddies. And so when you have on an average ski slope in Colorado, you have this wide range, and that's fraught with problems, I'm sure, as every ski patrol can tell you,
Yeah. On so many levels, not just brain injury, right? Yes, but
on so
yes,
many levels, for
yes, it's
sure.
like you see people out of control, and you're like, oh my gosh, yeah. I think, yeah, it's creating caution in me for that. But yeah, I think I've seen people run into each other, and that is certainly scary.
Right.
So when we're thinking about this, and we talked a little bit earlier about concussions, and like what happens if you get a concussion before one heals, or you have second, like another concussion or a third concussion, and even if it's been a long time, like talk to me about that piece.
You are at increased risk for another concussion after your first concussion. You're at increased risk for another concussion, um, later on down the road, dementia, stroke. And I tell my patients that doesn't mean you're going to get that.
Hmm.
So many factors come into play. How did you get this? I tripped and fell. How'd you get this? I was playing lacrosse, but I don't play lacrosse anymore. Or or I was in a car wreck. The chances that you are in another car wreck are slimmer. It has to do with kind of how you got that. If you
Hmm.
are somebody in a high risk sport and you go back to that sport, you're going back into the mouth of the dragon, right?
Hmm.
You're at increased risk. You get a concussion in soccer, you're a girl, you get a concussion in soccer, you go back to soccer, soccer's a high risk sport. The sport alone confers some risk, and you already have a concussion, so you're at increased risk compared to your peers, compared to your teammates who never had a concussion. Okay. And so the the risk factors are just a single concussion, period. Other risk factors are that when there's prolonged recovery. So I ask my patients, Do you have a history of concussion? Yeah. Okay. Well, tell me when and tell me how and how long did it take you to recover? If it's taking you months to recover, that's not a good sign, right? That's not a good sign that you have the resiliency in your brain. It has nothing to do with the spirit, the fight, the will. It's kind of mistaken, but just the brain injury itself not responding took you months and months and months. And maybe these folks got really great care. It wasn't months without any care. They got really great care, but it just took them long. And then they go back to that sport. They're at really increased risk. And that's where modification of activity comes into play. I know that you were a great soccer player, sweetie pie. I know you were, okay? But we've got to make some adjustments or you're going to be back in my office. It may not be in 3 months. It may not be next year, but it'll be the year after, et cetera. And I think that, again, it gets back to understanding risk and your comfortableness with risks, whether you're a kid, parents understanding risk, but you have a concussion, you're at increased risk for another concussion. And the more concussions you have, the greater the risk that you don't make a full recovery. So folks might say, I feel fine on a day-to-day basis. I don't have headaches. My vision is good, or maybe I wear special lenses, and because of the lenses, my vision is good, but I'm just not sharp like I was. Or my personality is a little bit different. So I function fine, but I'm not the same person. And
Which I think that piece can be really hard for people, is
very
not
hard.
feeling like themselves.
That's right. That's right. I had a 22-year-old in my office the other day. She came in with her best friend. They've been best friends forever. And then 3 years ago is when she got her concussion. And her best friend was crying and saying, this is not the person that I've known. We used to go shopping. We used to run around in the car, music blaring, singing, singing, singing. My friend can't tolerate that anymore. 3 years, 3 years. And how she made it through a college program is just by honestly sheer will. But she's not herself. And so it's very hard. It's very hard to see that if you're friends and family, and would be very hard to live that. And then you have to make the adjustments, right? The transitions. I used to snow ski, but I can't do that anymore. It's too risky. I'm not myself now. If I get another concussion, what will I be like? Right? Will I even be able to work? That type of thing.
Yeah, thinking about those risks. And I think that's so hard because we don't, I mean, this makes me think of the example of like the elderly person who their kids are saying like, mom or dad, you can't drive anymore, right?
Yeah.
When we get that part, not because of a concussion or anything, just because they're aging and their resiliency and their awareness and their reflexes to things just naturally are declining. And like, that's such it feels like your freedom's being stolen, right? Like you don't want to be dependent on people. And I think in concussions, I see in my office that people, that's so upsetting because they're not able to do things the way that they used to. So I think that's really hard.
That's right.
Yeah.
Their life was big, Bryce, and now it's smaller.
Yeah.
And as you well know better than I, some people can adapt to that more easily than others. And if that kind of that decrease in life, whether that's your social life, your recreational, family and friends, I would go to birthday parties or family gatherings. Now I can't do that, or I can be there for 15 or 20 minutes and then I feel the anxiety, I feel the walls closing in and I have to leave. You can't be engaged like you used to. Some folks make that transition a little bit better, and then some folks don't. And if it's tied to income and your work and the lifestyle of your family or your own personal lifestyle, it can have then also other ramifications.
Absolutely. So now we talked about what concussions look like, all the problems, but like what should we do if we get a concussion? So thinking about ourselves, but also our kids. So let's say we have a concussion or a kid has a concussion and we know it is. What are the steps that we should do?
Well, I think that that when you have athletic trainers on the sidelines, if it happens in a practice with school or if there's other healthcare personnel, so that's where it starts. You know, you have signs and symptoms of concussion, you're not going to play. And then after that, as I mentioned earlier, if you have significant symptoms, these headaches are worsening, they're horrific. Now I'm really nauseated, there's vomiting, more confusion. That's when you go to the ER. After that, follow up with your primary care physician, follow up with your pediatrician or your family medicine physician, okay? And then the formulation of a typical plan is this. Number one, taking care of the symptoms. So if you have a headache, maybe some headache medicine, nausea medicine, that type of thing. And I'm talking about early on, okay? You want to be comfortable. Having a plan where you have good sleep hygiene, you have a regular bedtime and you're getting to sleep well. There used to be this stay in a dark room, don't really go out, the decreased stimulation. We know that emotionally that is not good. And also from a physiologic point of view, it's not good to have that isolation and that kind of sensory deprivation. So can you go back to school? And if so, can you go back full days? Or do we have to make modifications? Maybe you go half a day for a few weeks. How do we modify this? It might be somebody goes to school for half a day and then their headache is getting worse. So we kind of modify that around their symptoms. If their symptoms persist beyond a few weeks, then I think there should be consideration, there certainly is in our clinic, consideration for vestibular rehabilitative therapists if they're having dizziness and balance problems, because those are the folks that can help them with that. Sometimes the vision changes, and the vision changes are not because of the eye. I explain to my patients, we see vision, we see with our brains. We have to have good eyes. The eyes send information to the brain processes it, and we have vision. When you have a brain injury, you can have disrupted vision. It's extremely common, and sometimes special lenses will help. But you have to go to an eye doctor who understands TBI-related vision changes. So you don't get like a nearsighted, farsighted diagnosis, which is an eye situation. You get an evaluation for eye tracking to assess vision related to traumatic brain injury. So sometimes lenses can help. Physical therapists can help because a lot of times when you move your head violently, the back of the head and the upper neck can really get inflamed. And so physical therapists can help us with that. And that can feed headaches, which can be horrific at times. Setting up with the school academic accommodations, longer time to complete assignments, longer time to take tests, maybe having decreased volume of homework. Those types of academic accommodations can really take the pressure off the kid who, if they got this from a sport, is already feeling the pressure of not being in their sport, right? Yeah. And so what we can do as adults is step up and say, okay, we're going to make this easy on this child who's trying to recover from a brain injury. It'd be bad enough if they were recovering from a knee injury, let alone a brain injury. So what can we do to help them with that? Maybe hat, sunglasses, even indoors can help make it a little more comfortable for them. Decreasing exposure to loud environments like the cafeteria or hallway. So maybe they leave one class a little bit early to get to the next class. Maybe they have lunch in a quieter area with a friend to maintain those social engagements, but in an environment that's not so onerous for them, that's not so symptom provoking for them. Longer term, then, mental health professionals, speech language pathologists to help with thinking and processing and task completion. And then it's really when we see patients who've had symptoms longer than 2 or 3 months or beyond. I referenced the 22-year-old who really has had no care for the traumatic brain injury 3 years ago, lives kind of in a rural environment. And that's not an unusual presentation for our clinic, but when you see symptoms lingering longer, that is multidisciplinary. And those orders come fast and furious, from mental health to endocrinology to physical therapy, vestibular therapy, speech language pathologist, maybe occupational therapy for vision, certainly a vision specialist for evaluation of TBI-related vision changes. And maybe if they're in school, maybe tutors and certainly academic accommodation. So a whole host of things as we're trying to, as my father-in-law would say, turn around the Queen Mary, which is takes time and and can be really, really emotionally taxing for the patients.
Yeah. Well, and I like this idea of what you're saying. There's so many people that can be involved when symptoms are lingering. And I think something I would add to that, that I know you do because you have a list of people that are trained and knowledgeable about traumatic brain injuries, but I think not every therapist knows about brain injuries. And the truth is, I was definitely not trained in brain injuries. However, I have been educated, right? And so I would now be able to consider myself knowledgeable about this, but it is something that we don't necessarily in our training in graduate or doctoral school get that type of information. Plus it's evolving, right? So we're getting new information. So I think also ask, right? Are you knowledgeable? So if you go to your eye doctor and you say, are you knowledgeable in traumatic brain injuries? If they're not, that's okay. Find somebody who is, right? Or the mental health person or the physical therapist or whatever, asking those questions to advocate for yourself because you don't want to waste time. I think that these brain injuries are also time sensitive, right? When we
Yep.
do have an injury, we do also need to have a responsive action to that. And the sooner we're responding, the better care we get. And I think that helps our brain to heal to the best of its ability.
That's absolutely right. TikTok, as I say to my patients, especially those who've had symptoms lingering for months and months and some even years. And I think that at that point, they really need somebody who's just specializing in concussion to help navigate, navigate what will be for that patient an onslaught of medical professionals to try to help them in all these different aspects to improve. Probably after a few years, we're talking about managing symptoms, not curing them.
Yeah. Which I think can be very frustrating too, for
Oh my
sure.
gosh, for sure,
Yeah.
definitely,
Yeah.
definitely. There are
Yeah.
reasons there are tissues in my office.
Yeah. Yeah. I mean, just that, yeah, it's a grief process, right?
It
When
is.
you find yourself in a place where you've lost something or a dream that you had for yourself that you feel like
Yeah,
you're not going to be able to achieve anymore. And
right.
sometimes I think you said pure persistence and sometimes that works, right? But for some things it does not matter how hard you work. It is really hard to overcome that brain injury.
You can make some decisions that can help you improve from the brain injury, but you can't just will yourself to brain health. You need
Hmm.
help with that in a
Yeah.
variety of of ways and a multidisciplinary approach.
Yeah.
Um, you can't just say, "Well, today I won't have anxiety." That's ridiculous,
Yeah.
right? You would say, I think. Um, but how do we manage? How do we cope? What skills do I have? Am I developing? What medicines, what tactics, what strategies am I employing to make today good, to
Hmm.
decrease my symptoms so I can go to school, go to work, that type of thing?
Yeah. I think mindset does matter, but I don't think we can just will away
Cannot just
things.
will it
Yes.
away.
Yeah.
We don't have
Yeah.
those superpowers. We are not Marvel studio, um, characters. We are human beings.
Yeah.
I tell my patients too, because they will, it is very interesting. If somebody falls and injures their knee, they don't wonder why they're limping. But in my office on a regular basis, patients will say, I don't know why I'm like this. I don't know why I'm like this emotionally. I don't know why I can't think. Why am I not sharp at school? I used to be really quick. About fourth grade, we all know who the smartest kid in the class is, right? Or the
Hmm.
perception of that, right? We know how we operate our brains. And when we're not like that, and they'll say, I don't know why I'm like this. And I'll have to say, you have a brain injury. You have a
Hmm.
brain injury. If you had a knee injury, you wouldn't be wondering why you're limping.
Hmm.
But the brain does everything, produces hormones, regulates our heart rate, um, thinking, everything, right?
Yeah. Walking,
Everything.
breathing, right?
All of
All
it.
of the things. Yes.
And then we get back to my first visit with patients where I say everything the brain does can be, doesn't have to be, but can be affected by the brain injury. And everything we bring with it um, into the brain injury can be adversely affected, like gas to the embers.
Yeah. Yeah. Well, and as you were saying that, I was kind of like, it's our brain is kind of our electrical panel. in our homes, right? And if you had a fire in your electrical panel and you're like, it destroyed or whatever, a part of the panel, and you're like, why doesn't this turn on anymore? You wouldn't say that because you're like, it caught on fire, right? And
Right.
the benefit to that
Right.
is you can get a new
Mhm.
electrical panel, right? Like we can replace that, but we cannot get a new brain, right? It's the only one we have, which is also why it's so important to take care of our brains.
Right, right. And the brain is remarkable in its through therapies like vestibular, through therapies like that related to post-traumatic stress, um, through physical therapy and
Mhm.
vision therapy. The brain is remarkable in its ability to respond to that, what we call neuroplasticity, the
Mhm.
ability to lay down new memory, the ability to lay down new skills, et cetera. But this takes time.
Mhm.
And again, when there's long-term symptoms, um, lingering symptoms, then oftentimes it is a matter of managing, not curing.
Yeah. Okay, so we've downloaded a lot of things. What do you want parents to take away from this conversation? What do you think are the really important pieces?
Two things: be aware and listen to your child. Be observant and listen to your child, and set up a culture in your home, and make sure also that the culture um, is what you see on a team. And the culture is this one of openness. If you're injured, tell me.
Mhm.
If you don't feel good, tell me. Which is to say at home, which is also to say on the field or the pitch or the court. If you don't feel good, tell me. If you just got hit, tell me. Which is to say the coach has to set up that culture. There has to be a culture of openness, and there has to be a culture in youth sports so that it's fun and we're learning teamwork and we're empowering ourselves and developing personal confidence and all those things that is beyond the scope of this podcast here, Bryce. But the culture of the team and the culture of the home has to be one of, hey, we're going to be open and honest. And if you don't feel good, if you feel a headache or dizziness and all these other symptoms of concussion, you tell us in a safe place, and we're going to get you help.
Yeah.
Step one, we're going to just pull you out for a little bit, whether that's a game or whether that's practice. And we're going to go to somebody, pediatrician, family medicine physician, et cetera, who can help you manage this, make a proper diagnosis, step one, and then manage it. But set up a culture where there's openness and the athlete doesn't feel threatened or belittled, or worse, an environment on a team, particularly where that's seen as weakness,
Mhm.
which
Yeah.
is, by the way, in my view, a sign that the coach should not be coaching.
Mhm. I agree.
But that's another
A
pod,
topic for a different day, but I think it's a
another.
great one to definitely
Okay.
dive into. Well,
Abs-
thank you so much, Dr. Lori, for joining us today. This has been such a great conversation. I know I'm taking away a lot from all the things that you've shared with us.
Bryce, thank you. Could talk about concussion all day long, and appreciate the opportunity to get some information out there. Thank
Yeah.
you.
Thanks again, Dr. Lori. This is all fantastic information. I don't know about you, but there's a lot of things that I've taken away from this. But one just being that we need to be our kids' best advocate, and also to be asking the questions to make sure that they are okay. And if they are not, to get them the right care. With that, I will say thank you so much for your time today. Please like and subscribe to our show. Give us a rating. Follow us on Facebook and Instagram and TikTok. And also, please keep the emails coming. We are loving the questions and also the topic suggestions to accidentalexperts@gmail.com. Have a great day. Some words from our legal team.
The information presented in this podcast is not intended or implied to be a substitute for appropriate professional advice, diagnosis, or treatment. All content, including text, graphics, images, and information contained on or available through this podcast, is for general information purposes only. This podcast makes no representations and assumes no responsibility for the accuracy or information on or available through this podcast, and such information is subject to change without notice. You are encouraged to confirm any information obtained through this program with other sources and review all information regarding any condition or treatment with the appropriate professionals.
What we're saying is, yes, I am a real therapist, but I'm not your therapist.